Hello everyone, I'm Dr. Mahboob, your ophthalmology faculty, and today we are going to start our INICET Power Pack Revision 2.0 for the upcoming INICET exam. Remember that our INICET Power Pack Revision 2.0 program will be covering under this 5 heading. Image related concept will be discussed under 3 videos. Tips and tricks related MCQ means all those MCQs which require any type of sort of tricks, any type of tips, that will be covered under the 2 videos of tips and tricks related videos. The third will be ratifying based concept, means those things which require only remembrance, you have to mug it up, like those things will be covered in ratifying based concept MCQ under 2 videos. Fourth one is important one-liner. Only one-liner will be discussed under this topic, which have been asked repeatedly. And the most important, the last one, will be repeatedly asked. That is the MCQ or the topic which has been asked twice or more in the exam will be discussed under this one video of topic. Okay, so this whole will be an INICET Power Pack 2.0 revision. Okay, and this will be covered, this will be completed by 26th of October. And if you want the PDF and many more revision thing, then join my Telegram group, Dr. Mahboob Aiims Delhi Ophthalmology Wizard, and it will be available by 27th October. PDF will be there. So start revising your INICET and start preparing for self. Now we will be starting with our image related MCQ part 1. Okay, coming to this, now you can see, can you see this image? Yes, this image and this image. What is that? What is this? You have to answer the cows, you have to answer the most common cows. Let's see. So सबसे पहले, the first thing that you have to understand here is that this is a fundus photo, and this fundus photo has a coloboma here. What is this coloboma? This is coloboma of coloboma. This is called fundal coloboma. Okay, and what is this? This you can see, as you can see here, this is nothing but this is a iris coloboma. Iris coloboma. Basically, I am talking about coloboma. So what is the cause of the coloboma? The cause of the coloboma is nothing but wait, failure of closure of embryonic cleft by 6th to 7th week of gestation. Understood? So basically you have to understand, by 6th to 7th week of gestation, embryonic cleft closes completely, means closes inferiorly. Inferior portion is the last to close. Okay, so closes completely. But if somehow by the 6th to 7th week of gestation this failed to close, then it gives rise to the coloboma of fundus, coloboma of iris, coloboma of eyelid, coloboma of choroid, coloboma for every structure of the eye. Okay, most common site. Here they will ask you the most common site. The most common site for iris coloboma is inferonasal. Nasal. This is very important MCQ. So you have to remember it is inferonasal. Okay. One more important thing to understand about the fundal coloboma, that they can ask you what classification, not about everything about classification, but they can ask you the name of the classification for fundus coloboma. So the fundus coloboma का नाम है Edelman's classification. Edelman's classification. Okay, understood point? So now you have Edelman's classification for fundus coloboma. One more important thing, that whatever I have discussed till now is true coloboma. If I am saying true coloboma, that means there must be something called false coloboma. And what is that coloboma? Yes. If I will ask you the lens coloboma. What is this lens coloboma? Lens coloboma is a false coloboma. False coloboma. It is not the true coloboma. Why it is not the true coloboma? Because it is developed. Because it is developed due to the developmental defect in jonules. So there is a developmental defect in jonules which appear as a notch, and that is lens coloboma. So lens coloboma is a false coloboma. So with this image, you can have a various questions like what is this fundal coloboma, what is the classification, Edelman's classification. This is iris coloboma, and most common site of iris coloboma is inferonasal. This is very important. What is the cause of the coloboma? Failure to closure of the embryonic cleft by 6th to 7th week of gestation. And lens coloboma is a false coloboma, not a true coloboma. It is because of the developmental defect in the jonules. Understood? Now, after this image, we have a very important to understand that this point. What is this image? The second image is saying, what is the second image saying? You have to remember that this is a notch in the upper eyelid. So what is this notch? If there is a notch in the upper eyelid, this is nothing but this is upper eyelid coloboma. Again, because of this is also because of the defective closure of the embryonic cleft by 6th to 7th week of gestation. Understood? No need to go into the cause. But what question they have asked? This have been come in examination, and they have asked what is the most common complication in this type of cases. So if somebody asks you most common complication here, so most common complication will be what? Suppose this patient closes his eyes, but this area will remain exposed, and since this area remains exposed, the cornea remains exposed, it can cause what? Exposure keratopathy. So this is an important MCQ, have been asked in the examination. Related to that, if somebody asks you what are the other complications, obviously there is a corneal ulceration, obviously there is amblyopia, okay, and there are so many consequences of this things will be there. Understood? Now, so moving to the next image, this is what is this? There is an image, this is a cross section, coronal cross section of extraocular muscles. Now they have asked that what is this muscle is supplied by, what is this muscles? This muscle is supplied by, nerve supply. This is a very important MCQ, right? So to understand this, we have to understand the different point. Okay. So what do you think? What is this? Okay. So there is the 4 extraocular muscles, superior of, if we do know it, this is the all extraocular muscles are present here. Okay. Now our idea will say that this will be medial rectus. Our mind will say that our mind will say that this will be medial rectus because it is towards the nasal side. What is this? This will be lateral rectus. What is this? This will be superior rectus, and this is very inferior rectus. So these four muscles are very easy to identify. Got it? Now what about this, what about this, and what about this? So remember, above the superior rectus there is a levator palpebrae superioris. So this is levator palpebrae superioris, LPS muscle. Now what is this muscle, what is this muscle? A very simple thing, that from orbital apex there is a one muscles coming forward anteriorly towards the medial side, and at a point called trochlea it bends posteriorly to the superiotemporal region behind the equator to find its insertion, right? Remember, this is nothing but superior oblique muscle, superior oblique muscle. So this is superior oblique. Automatically this will be the inferior oblique. So all those muscles, you know, and very important to understand. Now they can ask you, what is this muscle supplied by? If you know the muscle's name, now you can easily answer. It is SO is supplied by fourth cranial nerve, trochlear nerve. Got it? If they ask you what is this muscle is supplied by, obviously this muscle is supplied by sixth cranial nerve. What is this? This is a very important muscle. They can ask you what is this muscle supplied by. Obviously inferior oblique है तो third cranial nerve से supply होगा. LR6, SO4, rest are 3. So you know about this LR6, SO4 and rest by 3. Got it? So in this way you will understand how to find out this coronal cross section of the extraocular muscles. You got my point? This is a very hit question, superior oblique, so remember this only. Okay? Next, this is a ray diagram. Very easy. You have done it before the MBBS also. But you have to know. Easy, but you have to know. Now the rays are coming from here, but rays are meeting here in front of the retina. They are meeting in front of the retina. And if they are meeting in front of the retina, what is the refractive error? Yes, the refractive error will be myopia, because the eyeball may have elongated and so the image of the object is falling in front of the retina. Now for myopia you need to add minus lens. Very simple, it's a minus lens. Okay, or concave lens. Remember, M for myopia, M for minus lens. Vice versa, for hypermetropia it will be a plus lens, and for hypermetropia, obviously hypermetropia it will be a plus lens. Is a very important optical questions, but very important one. Convex lens use करेंगे उसमें, तो convex lens use करेंगे, and then only what will happen? So the convex lens use करेंगे. So remember only this myopia and minus lens M. Okay, you will automatically get to know that hypermetropia will be plus. Concave lens and convex lens. This is very important to understand. Now, what is hypermetropia ray diagram? Hypermetropia ka ray diagram will be like this. Hypermetropia ka ray diagram will be like this. Right? यहाँ मिलेगा behind the retina. So you understand this point. This is a very simple thing, but sometimes you will get confused. So for that proper understanding, I have made this video, right? Coming to this, Next image. Can you see this fundus image? Okay, and can you see the correlating B scan of the same fundus images? What you can see here? I'm telling you, just see the disc. Disc is like this, somewhat tilted. So this is tilted. So this is tilted disc. Can you see there is a proper staphylomatous type of thing? So, but this is nothing but this is posterior staphyloma, and you know what? This posterior staphyloma is pathognomic of. This is pathognomic of myopia. I mean high myopia, right? So this fundus photo is of myopia. So ये myopia का photo है, myopic fundus है ये. That means this is myopic fundus. Okay. Now since this image is correlating this image, that means what is this? You can see the concavity. You can see the concavity here. This is not usual. This is very unusual thing. This concavity indicates posterior staphyloma, right? So you need to remember this. This concavity is because of posterior staphyloma, and this is seen only in myopia. I mean high myopia. So this is very important to understand. So if you will be given this picture or this picture, you should be able to identify high myopia. Now, completing this image, you need to have some idea about what are the other features of the myopia. The other features of myopia will be lacquer cracks. Lacquer cracks. Lacquer cracks are nothing but these are the breach in the Brooks membrane. Here, if you can see closely, this area, some areas are, you will be liking, there's a crack. There's a crack on the, just like the road. On the road, there will be a crack. There will be, like that only, there will be a crack here. Second thing, there will be a Foster Fuchs spot. Very important MCQ. Foster Fuchs spot. So this Foster Fuchs spot are the red spot because of subretinal hemorrhages at the macula or because of the choroidal neovascularization. Whatever be the reason, there is a red spot you will see sometimes on the myopia, on the fundus of a myopic patient, and that is called Foster Fuchs spot. So it's very important to understand. So basically this whole scenario is very important for you to understand the myopic patient. So myopic fundus will have a posterior staphyloma, tilted disc, lacquer cracks, Foster Fuchs spot, and this type of B scan picture. Understood? I hope. Coming to this, what is this? Can you see? There is a written flap. Something is कॉर्निया में कुछ कट करके फ्लैप हैव बीन लिफ्टेड अप, फ्लैप को लिफ्ट किया गया और यहाँ पे some spatula type of instrument is inside the corneal layers. Inside they have made a pocket in the cornea and something is like doing like this. These both are refractive surgical procedure. Now you have to identify what is this procedure and what is this procedure. If you see a flap lifted up like this procedure will be LASIK, okay, laser assisted. What is this? If you see some instrument inside the pocket of the cornea, this will be a SMILE procedure. A small lenticular incision such, okay? So both of them are refractive surgical procedure, but to identify them, you need to see the flap. If there is a flap, this is LASIK. If there is some instrument inside the corneal layer, this is a SMILE. Understood? So what is the laser that is being used here? दिस इज अ वेरी इंपॉर्टेंट एमसीक्यू। सो लेजर जो यूज करते हैं हम लोग यहाँ पे, वी यूज एक्साइमर लेजर। ओके, second important thing, what is the wavelength of this? It will be like 193 micron. So it will be 193 micron. You are using the wavelength of this. The third important point to understand regarding, before completing this image, what are the criteria? This is very important. Every time in the exam, this can become a hit question. Okay. So what are the criteria? Let's complete the criteria. The first criteria will be age. The patient age should be more than 18 years. Okay, understood? The patient age should be more than 18 years. Second criteria will be refractive error should be stable more than 1 year. The third criteria will be corneal thickness that should be more than 450 micron. And the fourth criteria will be no any other ocular pathology. चाहे वो कोई भी हो, रेटिनल हो, लेंटिकुलर हो, whatever type of pathology, there should be no any other ocular pathology. So this four criteria is very important. One, age should be more than 18. Second, the corneal thickness should be more than 450. Third, refractive error of that patient should be stable for at least 12 months or 1 year. And there should be no any other ocular abnormalities or pathology like retinal pathology, choroidal pathology, whatever pathology should not be there. So this is very important MCQ as far as the image is concerned. Got it? Okay, moving to the next. Oh, this image have been asked multiple times in every exam. FMG, Neet, PG, INICET. So this is very important and few points only to remember. Can you see what is this? Name this. Okay, let me name it. This is Storm's conoid. You know this is Storm's conoid. Whatever the ray diagram is, this is a hypothetical ray diagram. Okay, this y-axis and this h-axis, v-axis or h-axis, vertical and horizontal ray diagrams have been added. You see, they are not equal. Vertical is more like this and horizontal is very much smaller. So they are not equal. Okay, one. Since both the meridians are not equal, so that means the rays that is coming here at every point they are not equal. And the question arises which have been asked in exam that this Storm's conoid is representing what type of refractive error. So in this condition, the refractive error will be nothing but it represents astigmatism. So this is very important MCQ. Understood? Now, the second important thing that at each and every point they are making some image formation. Like at A, point B, C, D, E. They have asked one question typical, at what point there will be a least confusion. That is, they have asked circle of least confusion. Now you have to choose among A, B, C, D, E, F. Which is most circular? This point is the most circular. So our answer will be point D. This point will be the circle of least confusion. So you have to remember that Sturm's conide में ये 3 क्वेश्चन पूछेंगे. That what is this Sturm's conide? What is this refractive error, astigmatism, and the circle of least confusion is point D. That's it. Nothing more than that. Coming to the next image, a very important one. So this is the normal object. A normal person can see this object. But these two are the abnormal object, abnormal perception. These two are a patient, different patient will see this normal object like this or this. Now you have to identify what type of distortion these both are. Okay, let me tell you. Can you see this? This is the cushion type. Something, you have a cushion in your home, right? In your sofa, on your sofa. Have you seen this type of cushion? Circular like cones. So this will be pin cushion effect. And have you seen a barrel of wine in movies, everywhere? You see a barrel of wine like this. So this will be a barrel distortion. Now, the question is, what type of patient will have pin cushion effect? What type of patient will have barrel distortion? Suppose a patient is having a patient is aphakia, aphakic patient, right? If a patient is aphakic, then what glass you will suggest him? If a patient is aphakic, then you will suggest him to wear plus glasses, or I can say high plus glasses. What usually I prescribe? Plus 10 diopter glasses I prescribe. So when the patient will wear this high plus glass, he will have this effect. So this effect is because of high plus glass. So this is pin cushion effect will be seen in aphakic patient, because aphakic patient will wear the high plus glass. Vice versa, in high minus patient which is having who are wearing a very high minus glasses, like high myopic patient, very high myopic patient, high minus glasses, किसमें मिलेगा? Myopic patients में will have a barrel distortion. So you understand the differences. What is important here? This pin cushion is very important. Do you remember this? Very important. They can give you a scenario. A aphakic patient is wearing a plus 10 glasses, plus 12 glasses, or high plus glasses. Will see this object as this. What is this effect called? Pin cushion effect. This type of MCQ will be coming in examination. So I hope you understand this image. Now, can you see this? Yes. These are the 3 instruments that is regularly being used in our OPD. A patient अगर आता है हमारे OPD में, then the first thing, we are using a preliminary examination for every patient. We use this type of thing. Now we have to identify, because you see daily in the OPD, it's very common. So you need to remember. Okay. Now what is this? Tell me. Anyone? Okay. I will tell you. That can you see some hole here? Here, यहाँ पे. This is pinhole. Pinhole. What is the diameter of the pinhole? Is 1.2 millimeter. So this is very important to know the grossly. If you want to know what is the refractive error, how much he can see, you can use this pinhole. Okay. What is this? This is a retinoscope. So this retinoscope is named as Priestley Smith Priestley Smith retinoscope. This retinoscope is not being used nowadays. Understood? You just need to remember the name. What is this? And this person is using this instrument only. So this is a self-illuminated. Self-illuminated means they have their own light source. Self-illuminated retinoscope. And what is this procedure is being done here? This procedure is called retinoscopy. What is retinoscopy? Retinoscopy is nothing but it is a method to identify or correct and refine the refractive error to give a correct possible spectacle correction to any patient. So this retinoscopy is done to do that. Okay. Now, when that patient means if this person is doing retinoscopy, then what is he seeing in his eye? इसको क्या दिख रहा है इसके आंख में? Something. He is seeing this type of picture. Okay. So this yellow one indicates the retinoscope movement. He is moving his retinoscope like this. And this red one are the red reflexes that he is seeing in the eye of the patient. These red reflexes are present in the eye of the patient that examiner is watching. Okay. So can you see it is a perfect sphere? That means there is no movement. Even if the retinoscope moves, there is red reflex, no movement. So what is this? This is no movement. So if there is a no movement, then remember, if there is a no movement of the red reflex, this is nothing but myopia of one diopter. So if there is a no movement, this is one diopter myopia. This is one diopter myopia. If you remember this, other things are very easy. No movement, myopia one diopter. Remember. Now, can you see here? Retinoscopy is moving in this direction. Red reflex is moving in this direction. That means red reflex is against the motion, right? So the movement is against. So it is against the motion. Got it? Now, if it is against the motion, take this A word, take this M word. A is A verb. I'm telling you the mnemonics here. This is not the proper thing. Against the motion, I'm telling the mnemonics, which is very important to remember. A for A verb, remember. M for myopia. So remember, against the motion, you need to remember A verb myopia. A for A verb, M for motion, and for myopia. So what is A verb? How much A verb? How much A verb? It is more than this. More than one diopter. So if there is against the motion, that means it will be a myopia of more than one diopter. Understood? Rest of the thing will come under here. What is this? This is with the motion. With the motion. So if there is a movement is with the motion, that means it can be myopia less than one diopter, right? Emetropia, right? And hypermetropia. What I have told you, just listen carefully. Then you will understand everything. And any confusion, DM me. So in this way, you can understand everything. Just remember this, no movement is myopia one diopter. Against the movement means A for A verb, M for myopia. And how much A verb? One diopter, from one diopter. So myopia will be more than one diopter. And anything, rest of the things will comes under this with the motion. Understood? Now, coming to the next image. These two images very important in optics, right? What is this instrument called? This instrument is known as JCC. What is JCC? JCC. JCC is nothing but it's a Jackson cross cylinder, right? So you can see this is a Jackson cross cylinder. Okay, so what is this Jackson cross cylinder? There are the few questions that can be asked on the Jackson's cross cylinder, that what type of lenses is used here. So the type of lenses that is used here is sphero cylindrical lens. Means sphero, there is a spherical power, cylindrical, there is a cylindrical power. Matlab, this type of lens having a spherical power also and cylindrical power also. So what is the most common combination of the lens? Obviously sphere and cylindrical, both the lenses are there, that means it's a combination. So what is the most common combination it is being used? There are different combination of lenses that can be used in the JCC, but what is that most common? The most common is minus 0.5 diopter sphere and plus 1.0 diopter cylindrical. This is the most common combination that is being used. Now you know about the Jackson cross cylinder. Now what is the use of this Jackson cross cylinder? क्यों होता है use? It is used to refine the cylindrical power. A patient को cylindrical power देना है, and you want the refinement. And if you want the refinement, you need to do Jackson cross cylinder like here in this case. So the use of this is refinement of cylindrical power. So you have the few MCQ related to the JCC, like JCC, this image is spherocylindrical lens, 0.5 diopter spherical plus 10 diopter cylindrical is the most common combination of the lenses, and this is the image where this JCC is being used, and this is used for refining of the cylindrical power. Understood? Coming to this photo, this is a red-green chart that is used for chromatic aberration. Okay, the principle of this is chromatic aberration. Principle क्या है इसका? Principle is chromatic aberration. Understood? Now, this red-green chart is used for refining spherical power. Understood? This Jackson cross cylinder is for refining cylindrical power. This red-green chart is used for refining spherical power. How it is being used? If a person see this image and he told that if a patient is seeing this image and he is telling that red appears more, means he can see the red one more clearly, and he is telling red appears more. RAM, red appears more. Mnemonic is RAM. That means if red appears more, that the patient is myopic. Understood? You remember the mnemonic RAM, red appears more, it is myopic, M for myopic. So I can write here, if this area appears more, this is myopic, and vice versa. If this area appears more, this will be a hypermetropic. Understood point? Easy. Red appears more, myopic, RAM, remember only this. Coming to next MCQ, this and this instrument you need to know, very common instrument for the OPD procedure. What is this instrument? Anyone? This is indirect ophthalmoscope. And what is this? This is direct ophthalmoscope, right? Now, this two instrument that is being regularly used. What is the difference? That's very important to understand. So here I am writing the differences: direct ophthalmoscope, indirect ophthalmoscope. If you are with me, let's make some column here. Okay. And now, right, what is the magnification of direct ophthalmoscope? Direct ophthalmoscope can magnify image up to 15 times. Indirect ophthalmoscope, depending upon the condensing lens, it can magnify the image by 3 to 5 times only, right? Coming to the field of view, direct ophthalmoscope in large, because the magnification is very high, it can see very small area. Direct ophthalmoscope. So only 2 disc diameter. The area field of view is only 2 disc diameter. However, for this indirect, the area is 8 disc diameter. Remember, you need to remember all these things. Hazy media. The illumination in this indirect is very high, so it can see through the hazy media, but difficult with that of ophthalmoscope. Direct. Image type. Remember one thing. Have you watched the movie Devdi? Devdi is a movie. Devdas. So direct ophthalmoscopy E for erect and V for virtual. Understood? You got the point? Devdi, remember Devdi? Then you can easily answer this image. Erect and virtual. Similarly, vice versa. Real and inverted. You understand the point? Stereopsis. You know what? Let me tell you that stereopsis is a function of both eye, or is a function of, I can write, is a function of binocular vision. Binocular vision means patient is seeing with the both eye. Here only one aperture is there, so we are using only single eye. Will look like this with this. So only one eye is used. So obviously there will be no stereopsis here. There is a monocular vision. But here there is a two aperture. यहाँ पे भी और यहाँ पे भी. So there is a binocular vision in this, and that is why stereopsis is present here. Stereopsis is present here. यहाँ पे नहीं होगा. Condensing lens is not used here. यहाँ पे 20D का कंडेंसिंग लेंस यूज होता है. मोस्ट कॉमनली 20 डायोप्टर का कंडेंसिंग लेंस वी आर यूजिंग. So this is all about the indirect and direct ophthalmoscope. This is very common. You have to remember that. There is no excuse for that. I'm sorry, but there's no. I have told you the many mnemonics regarding this. Understood? Coming to this important MCQ. Okay. This is coming to the end of the optics. Okay, one more image is left for the optical images, right? What is this image? So I have written very simply. The question is simply asking. The question is simply asking, what is this? This is nothing but, this is Jogren's hand chart. So this is nothing but, it is Jogren's hand chart. Okay, this is Jogren's hand chart, and this is used in a patient preschool children means a person, the children, preschool children, for preschool children. If you want to determine the vision in a preschool children, we are generally using this hand chart, Jorgen's hand chart. Very important to understand. Okay, very important MCQ. Coming to this, what is this? Spectacles and images is telling you uses of this type of spectacles. Remember, what is this instrument? This is a bifocal lens. Understood? This is a bifocal. These are bifocal spectacles. But you can see here that the spectacles is bisecting from the middle of the pupil. From the middle of the pupil, right? So this portion is for near vision and this portion is for distant vision. And that is why it is binocular, right? If you have this type of bifocal where the line is bisecting the pupil, that means it is used in children. So basically it is used in children, generally aphakic children. Okay. Similarly, bifocal lenses also used in elderly, जिसको बोलते हैं हम लोग presbyopia. But what is the difference between this bifocal and this bifocal? The difference is, let me draw you this specs. In this bifocal lens, this is D-shaped bifocal lens. This is D-shaped. And this is not bisecting the pupil. Pupil is here. Okay. So D-shaped bifocal lens is used in elderly. And this bifocal lens where this bisecting the pupil, it is used in children. So this is very important to understand. Also accommodative esotropia may be one more use. Accommodative esotropia में भी इसको use करते हैं. So this is one use, this is second use of this type of lens, and this is about this. Understood point? Got it? Yes. Now this is the last image of the optical portion of the ophthalmology. That is important. What is this image? You can see there is a black line expanding like a fan. What is this fan? What is this image called or instrument called? This instrument called astigmatic fan. As the name is suggesting, it is astigmatic fan. Obviously, this will be used for refining cylindrical power. Understood? Astigmatic, we use cylindrical power for astigmatic, right? So astigmatic fan will be used for refining the cylindrical power. How? Very simple. All these lines should appear similar, of similar brightness. If a person is saying that some lines are brighter, some lines are looking more brighter, and other lights are not looking so bright, very dull, that means there is something error, cylindrical error is there. So now coming to the next image. What is this next image is telling you? These all are the cataractous changes in the lens, right? So all these cases are nothing but, they are secondary cataract, right? What is secondary cataract? Secondary cataract are those cataract, which is because of some sort of systemic diseases or metabolic disorders in the body. Okay, now you understand about the secondary cataract. Now let's see each type of cataract. So what you have an appearance like here. Can you imagine of a Christmas tree? The bulb hanging on the Christmas tree looks like this. So it is nothing but it is a Christmas tree cataract, right? It is a Christmas tree cataract. Now, do you know what type of condition where you have this Christmas tree cataract? Yes, of course, it will be in myotonic dystrophy. Understood? Now, second cataract. How does it look like? Can you imagine of some snowstorm or snowflake type of thing? Yes, in the Iceland, you will find this type of thing. So this is nothing but, what is this? This is snowflake appearance, snowflake cataract. So snowflake cataract is because of what metabolic disorder in the body? The metabolic disorder is very common, that is called diabetes. So it is because of diabetes mellitus type 2. Understood? So this is very important to understand. And what is the cause of, what is the metabolic product that accumulate in the diabetes? Very important MCQ. The metabolic product that accumulates here is sorbitol. It's a very important MCQ. Understood? So snowflake cataract is because of diabetes and it is because of the accumulation of sorbitol. Now coming to this center wala thing, how does it look like? Just imagine of a flower, a sunflower. Yes, it is not typically, but it looks like sunflower. So I can say it's a sunflower cataract. Where it is found in the sunflower cataract? What type of metabolic disorder you will see in the sunflower cataract? Yes, you can diagnose Wilson disease by looking at the lens. Wilson disease. And what happens in the Wilson disease? In the Wilson disease, there is a copper accumulation. Copper accumulation, right? So what investigation will you do to identify or to diagnose? What blood investigation you will do? You will go for serum ceruloplasmin. So all these are very important MCQ related to this. Okay, they can ask any of this question by giving this lens wala picture only. Okay, now coming to this here, what does it look like? If you can't imagine, just remember it is look like oil droplet. Oil droplet. So it is oil droplet cataract. Where you will see this oil droplet cataract. You see this oil droplet cataract in a case of galactosemia. Galactosemia. Now, one more important thing that to understand. Have you ever heard that you can reverse? Any cataract can be reversed. Generally, we say that if cataract has happened, then it cannot be reversed. Only thing that you can do is surgical extraction, right? But galactosemia in early stage is that type of cataract which can be reversed in early stage. So it's a reversible cataract. So it's a reversible cataract. Reversible cataract, right? But in early stage. So it's a very important MCQ. Now coming to this, what type of cataract appearance is there? This is nothing but, we can see it's a rosette shaped cataract. Rosette cataract. Rosette cataract. Where, in which condition this rosette cataract happening? It is happened in blunt trauma. So obviously you need to know what are the other conditions, what are the other signs that you see in the blunt trauma. We will be discussing this separately, right? So all about this, let's discuss fastly. This is the Christmas tree cataract because of myotonic dystrophy. This is the sunflower flake cataract because of the diabetes. And what product is accumulating here? Sorbitol. This one is a sunflower cataract because of Wilson's disease and because of the copper accumulation, and the blood investigation that you are going to do is serum ceruloplasmin. This is an oil droplet cataract which is seen in the galactosemia, and this is reversible in early stage. This is a rosette sept cataract which is seen in the blunt trauma. Okay, now moving to the next image. Okay, can you see what is this? What is this? These are all things related to some procedure called cataract surgery, right? So what is being done here? This is, what is this? This is a phaco probe, okay? And what is this process is done here? This is a phaco emulsification. It is done. Phaco emulsification. So this process of cataract surgery is phacoemulsification. This phaco probe is entered into the lens, right? Now looking at this, no need to go into the details of everything. Just remember this type of picture. If you see, then remember it's a cataract surgery, but this cataract surgery is a FLACS surgery. F-L-A-C-S. What is this FLACS? FLACS is femto laser assisted cataract surgery. So FLACS, this is FLACS surgery. So obviously it's a femto laser assisted. That means the frequency or the wavelength that is being used here is 10 to the power minus 15, right? So obviously, this is a very important MCQ question that have been asked in the INICET before also. So you need to remember the photo, you need to remember the full form, and you need to remember the frequency or wavelength, right? That's all for this image. Now, coming to the next question. So looking at this picture, if you look at this picture, what you are going to see? This picture, you can see some blue dots are there. Obviously this blue dot, if it is seen in a children is having this type of appearance in the lens. So this is nothing but, this is blue dot cataract. What is the importance of the blue dot cataract? It is the most common type of cataract. So most common type of congenital cataract. So this is most common type of congenital cataract. Now the next question is arising, does it need surgery? No, it does not need surgery. Why? Because this type of cataract does not cause any visual disturbance. Okay, so no surgery required. I can write here that no surgery required, and you know why? Because this does not cause visual disturbance. Then if it does not cause the visual disturbance and it is the most common type of congenital cataract, then one question is arising in my mind, what is the most common cause of congenital cataract that cause visual disturbance? So question is most common type of cataract, congenital cataract causing vision loss. The answer is very simple. It is jonular or lamellar cataract. So you have this type of MCQ here because of this. Okay, understood? Now coming to this MCQ, can you see this MCQ? You can see some ring-like opacification in the eye. Actually, it is in the lens. So this is a cataract. Obviously, any cataractous change, any opacification in the lens is cataract. But this is a significant circular onion, typical onion peel type of appearance, right? Onion. So if I am saying onion peel or ring appearance, where it is seen in posterior polar cataract. The cataract at the posterior pole, which it appears like this. Why it is separately discussed? Because this is a very complicated type of cataract. Even it is very small, high chances of capsular tear, posterior capsular tear is there. So it's a very risky to do this type of cataract surgery. That's why it's being discussed, and you need to know this onion ring appearance, right? Understood. Posterior pole is a very thin. The thinnest structure in the lens is posterior pole. It is about only 4 millimicrometer only. Okay. Now, if you have learned this image, now we have to come this image. Suppose this image is nothing but the patient is presenting. Let me tell you the scenario. The patient is presenting after cataract surgery. The patient is presenting like this. One patient is like this, other patient is like this. What is this? This is called after cataract. So these are nothing but this is after cataract, and there are the two types of after cataract. Okay, what are those two types of after cataract? Let me write after cataract. These are after cataract, and there are two types of after cataract. One is this, other one is this. So what is this cataract? This is after cataract. This after cataract is nothing but it is Ilsching pulse. Ilsching pulse. Can you see small pulse, small thing, pulse type of thing? This is called Ilsching pulse. And you can see this ring like of walls. They are the walls in the ring pattern. So this is nothing but this is Soime ring. So these two types of after cataract is there. Now the question is arising how to treat this. The treatment is very simple. The treatment is YAG capsulotomy. The treatment is YAG capsulotomy, and which laser is being used? The laser that we use here is ND YAG laser. Again, they will ask what is the frequency, what is the wavelength of this ND YAG laser. The wavelength will be 532 micrometer. So all these things are important MCQ, and everything is related to this. I hope you understand. If there is anything that I can ask if you want to ask, please DM me separately and join my Telegram group. Everything will be dealt. Every confusion will be sorted. Okay, believe me. Now coming to this important lenticular images. Can you see something? This lens is being displaced up, and this lens is on dilatation. You can see the whole of the lens. Nothing is here. What is this diagnosis? A gross diagnosis I will make here. The gross diagnosis that I will make here is ectopia lentis. This is the gross diagnosis that I will make here. What is this? You can see here there is a supero-temporal subluxation of lens. So here there is a superiotemporal subluxation of the lens, and it is this type of superiotemporal subluxation of the lens is seen most commonly in which condition? Anyone? Obviously, it should come into your mind fastly. It will be seen in Marfan syndrome. Understood? It is seen, superiotemporal subluxation of the lens is seen in Marfan syndrome. Now, few questions related all these things MCQ that have been repeatedly asked. Obviously, it's the cardiology things. Obviously, it's the cardiology things. Marfan syndrome, subluxation, bilateral superiotemporal subluxation. It will be a bilateral superiotemporal subluxation. Second thing is gene associated. Gene is FBN1. It is also called fibrillin 1 gene mutation. Understood? Third important point, the chromosome. Chromosome is chromosome 15q21.1. I will write it properly here, yaar. It will be 15q21.1. Understood? So this thing is very important. Now the investigation. Suppose this type of patient comes into your clinic. What will you advise first thing? You will ask the patient to go to the cardiology evaluation because of the risk of mitral valve prolapse. This Marfan syndrome is a connective tissue disorder. Obviously, they are at very risk of developing some congenital cardiac anomalies. So you need to have a cardiac anomaly, cardiac evaluation before you treat the eye. Understood? So send the patient cardiology evaluation, right? So these all few things that you need to remember about this thing. Now, coming to this image, you see when the pupil is dilated, you can see all of the lens. But this lens, if you can see all of the lens, that means lens is small, micro, and that is why I will call it micro spherophakia. This microspherophakia is seen in which condition? Then I will tell you, it is seen in wheel Marchesani syndrome. So this is very important to understand. Now, what are the other causes? You have the two causes of the ectopia lentis. One is the Marfan syndrome, other one is Will Marchesani syndrome. Marfan syndrome का important हो गया superiotemporal subluxation, and Will Marchesani का जो important point to remember is microspherophakia. The third important cause of ectopia lentis, जो तीसरा नंबर है, ये फर्स्ट हो गया, दिस इज फर्स्ट, दिस इज सेकंड, दिस इज थर्ड. This is nothing but homocystinuria. Now, so many times the question have been asked on the homocystinuria. A patient with the ectopia lentis coming with a mental disorder, something like this, and they will ask you what type of supplement that you will provide here or something. So we have to remember. So there is a deficiency. What happened in this homocystinuria? Homocystinuria में होता क्या है? Homocystinuria में deficiency of homocystothione synthetase enzyme. This homocysteine synthetase enzyme का deficiency होता है. So it is not able to convert homocysteine to cysteine. So there is an accumulation of homocysteine here and methionine. So homocysteine and methionine will increase and it can come into the urine. That is why it is homocysteinuria. And there is a deficiency of cysteine. Okay, so what are the supplementation that you can give as a treatment, as a supportive treatment in this condition? So for supportive treatment in this condition, the first is vitamin B6 and also you can give cysteine. So this is a very important MCQ related to that. One important thing that you need to remember that in homocysteinuria, you have a broken jonules. Broken jonules means, can you see here, these are the jonules. The lens is suspended with the jonules. So these jonules are broken in this homocysteinuria. Okay, this is very important to understand. Other causes of the ectopia lentis 4 that you need to remember is hyperlysinemia, Ehlers-Danlos syndrome. Okay, hyperlysinemia, Ehlers-Danlos syndrome, and sulfite oxidase deficiency. So we have the different types of the ectopia, causes of the ectopia lentis. One is Marfan syndrome, bilateral superiotemporal subluxation, gene is fibrillin 1 on chromosome 15, and patient should be sent for the cardiology evaluation. Secondly, there is a microspherophakia because of Weil-Marchesani syndrome. Third cause is homocysteinuria, where there is a deficiency of homocystothione synthase. Because of that, there is an increased level of the homocysteine and methionine. So the treatment that you can give is vitamin B6 along with the cysteine, and in this homocysteinuria, there will be a broken jonules. Other causes of the ectopia lentis is hyperlysinemia, Ehlers-Danlos syndrome, and sulfite oxidase deficiency. Understood? I hope this ectopia lentis is clear to you all. Coming to the next image. The next image is very simple. All you need to put your eye, a good observing eye to this. So if you can put your good observing eye here, then I will show you. This lens is coming from like this. Now it becomes like this. Can you see? Can you see something is like this conus? Obviously, this is called this is anterior lenticonus. Similarly, because the cornea is this, in this condition, the cornea, this is cornea, and anteriorly this is very flat, but posterior lens is like this. So this is the posterior surface. So this is posterior lenticonus. Okay, so answer will be, what are the causes of this? Anterior में ये याद रखना है. So the cause will be Alport syndrome. Posterior में L याद रखना है. The cause will be Loeys syndrome. As simple as this. Nothing is going to be, they will ask as far as ophthalmology is regarding. They are not going to ask any more than this. Okay. Now coming to this very important images. This image is of what is this? This image is obviously an image where the surgeon is performing cataract surgery. Got it? So the surgeon is performing cataract surgery. They can ask you step. कौन सा step है ये? Obviously this is a cataract सर्जरी, बट कौन सा स्टेप है? स्टेप इज एंटीरियर capsular axis. So this step is anterior capsular axis. You can see this is the capsule जो कि tear हो रहा है. This is being teared apart. So this is the capsular axis is being laid here like this. Okay. So understand this point. Other questions related to the cataract surgery, the steps of the cataract surgery are very important. One step I have shown you in the phacoemulsification. One more step it is this cataract surgery. You can find everything regarding the steps in my Telegram group. You can join that. Okay. Coming to this point. So let me tell you the scene or the history of this condition. This is the image of a patient 2 days after uneventful cataract surgery. So there is an uneventful cataract surgery. After 2 days, this picture is coming. You can see what is this? This is what is this? This is hypopyon, right? This whole cornea is edematous. That is corneal edema. Inflammation. This is congestion. Conjunctival congestion. So all these scenes leads to the diagnosis. What is the diagnosis? The diagnosis is acute post-operative endophthalmitis. Mostly यही diagnosis होगा. Now if you know the diagnosis, what should be the treatment? Treatment will be intravitreal antibiotics. This is the immediate treatment that you can do. Another question that can be asked is, if you know the diagnosis, then most common cause, it will be Streptococcus epidermidis. So this is the risk, this is the organism that is the most common cause of acute post-operative endophthalmitis. Another one important to understand, what is the most common cause of delayed post-operative endophthalmitis? So if I have to say that most common cause of delayed post-op endophthalmitis, the answer will be Propionibacterium acne. And by delayed, I mean to say 4 weeks, more than 4 weeks, right, of operation. So this is the important MCQ that they can ask related to this. Okay, understood? Coming to this image. This is also related to the cataract surgery. Why I am highlighting this cataract surgery? Because it's a very common procedure. Everybody needs to know. Every medical person should know about the common procedure that is performed in any medical field. चाहे वो surgery हो, चाहे ENT हो, चाहे वो cardiology हो, चाहे वो neurosurgery हो, everything. चाहे वो ophthalmology हो. So this is all also related to the cataract surgery. Now this ring is C-shaped. What is this ring? तो इसमें सबसे important जो जानने की चीज है, what is this ring is? अगर जो important चीज जानना है, ये ring CTR है. This ring is nothing but CTR. What is the full form of the CTR? The full form is capsular tension ring. अब इसका यूज कहाँ होता है? यूज क्या है? Before I tell you the use, let me tell you one thing. Our natural crystalline lens is supported by the jonules, right? When the jonules becomes weak, the lens will get displaced from its position. So after cataract surgery, if I want to place artificial lens in the eye, the capsule should be intact. Capsule should be tensed. That means journals should be strong. If the journals are not strong, we put this ring in the bag to provide strength, so that artificial lens should be in the place after cataract surgery. So this is used in case of jonular weakness in cataract surgery. Now you understand the very important. Coming to this, Arey bhai, this is the very first thing, first procedure before any cataract surgery. Nowadays, topical cataract surgery is becoming famous. Okay, but some surgeon, if we need to give local anesthesia, okay, injectable local anesthesia to the eye, we have a different procedure. So that is, before the cataract surgery, you are going to give the anesthesia to the patient. What is this? All this anesthesia represent. So obviously this is the globe, this is the optic nerve, this is the extraocular muscles, right? So this injection is what, and this injection is what. Understood? You see, this injection or this injection is outside the extraocular muscle, and it is around the globe. Around means peri. So if it is around and if it is peri, that means this is what? It is peri bulbar block. Okay. Now see this injection. Okay. Now see this injection. This injection is behind the globe. This is the globe. This is behind the globe. That's why it is retro bulbar block. One more important thing, what is the anesthesia? What is the drug that you will use? The drug that is used here is 2% lignocaine. Very important MCQ. This is peribulbar block, retrobulbar block, 2% lignocaine that is being used. So this is all about this type of images. Now again, I told you again, because the cataract surgery is very important, that you need to remember and know every type of cataract surgery. What is this? This is also, I have frown incision, scleral tunnel. This is also a type of cataract surgery. And this you can see here, they are making a frown incision. C-type incision is there. Now this instrument is inside the sclera, forming a tunnel. This is the tunnel. ये एक tunnel बना हुआ है, right? And then through this tunnel we are entering into the anterior chamber and doing the cataract surgery, right? This is nothing but, this is called as SICS. SICS मतलब scleral incision, because we are giving incision to the sclera. It is scleral incision cataract surgery. Got it? And we do not need to suture this. We do not need to suture this. We can just leave it like this after cataract surgery, and this will be stable, right? Now, before I move to the other image, I must tell you the history of some cataract surgery. This is because very important. The very first cataract surgery that come into the action remotely is ICC. Now this is obsolete. This is not being used. This is intracapsular cataract extraction. Second came ECC, extracapsular cataract extraction. What we are doing in the ECC, we are making a very big incision in cornea, and that is why after cataract surgery, sutures required. Suture required. Why I am writing this? Because this is a very important MCQ. After this improvement, there comes phacoemulsification. In this surgery, we are making a very small incision in the cornea, and with the probe, we are doing cataract surgery. So, no suture required. No suture. Then the latest is SICS, scleral incision cataract surgery. This is obviously इसमें भी no suture required. So the MCQ that they have asked, the cataract surgery where the suture is required, it is extracapsular cataract extraction where the suture is required. Understood? So if you see this type of incision, then you can tell this is an SICS surgery. And if you are seeing the probe, if you are not seeing this type of incision in the sclera, if you are seeing incision in the cornea, it is a phacoemulsification or ECM. Understood? Now with that, lenticular portion, images of the lenticular things have been completed. Coming to this very important MCQ, can you see? This is an image of a child or 2-year-old child. The 2-year-old child having a leukocoria in the left eye. If you see God say, then there is a lenticular opacity type of things will be seen here. So what you are seeing here, you are seeing here lenticular opacity. Lenticular opacity. This is nothing but unilateral cataract हो गया ये. Now unilateral cataract जब होता है, unilateral cataract in child, तो क्या होता है? What happen when there is a unilateral cataract? In the unilateral cataract in the child, then there is a very high risk of what? Amblyopia. अगर patient bilateral है, if the patient is bilateral cataract, chances of amblyopia is there, but not so fast. But if the patient is unilateral cataract, then the chances of amblyopia is very high, very fast. So you need to prevent the amblyopia as soon as possible. And how you are going to do that? Surgery. Cataract surgery. When will you do the cataract surgery? Very simple answer. As soon as possible. Understood? What type of lens you are going to put here? The eye of the child is small, so we have to put the IOL after under correcting this. Depending on the age, we do the under correction, and under correction ke baad we will put the IOL. One more question they have asked in the exam, that a child is aphakic, unilateral. Then what is the best possible treatment for the aphakic child? Obviously, they will give the option like spectacles, contact lens, whatever. But do you think that the child can wear the glasses for a long time? Do you think that the child can apply the contact lens? No, it's not possible. It is not feasible. So the best treatment that you can give to an aphakic child is intraocular lens implantation. Put the lens inside the eye, that's it. No need for any adherence. Obviously, you will undercorrect the power, but you have to put. So this is the MCQ that they have asked, right? Now, coming to the next question. I know that this is something that you cannot, this is very difficult to appreciate. But you know what? They have asked the same question. You have to imagine, they will give something Example, seeing the option, you have to get a clue that this is question something about Kaiser-Fleischer ring. Let me tell you how. You can see, if you are seeing very clearly, if you are seeing that, you can see here this one, this ring, this is what? This is something, a ring, a golden brown ring. This is nothing but it's a golden brown ring. Okay, this is called KF ring, Kaiser-Fleischer ring, Kaiser-Fleischer ring. Where you see the Kaiser-Fleischer ring? You see the Kaiser-Fleischer ring in Wilson's disease, and I already told you about the Wilson's disease. The first investigation to diagnose serum ceruloplasmin, copper is more here. This one more important MCQ that they can ask you, that where this golden brown ring is present in which layer of the cornea. Obviously this will come present in the deciment membrane. So this is also an MCQ. Understood? This is all about this MCQ. Now, एक 55 साल का आदमी है, 55-year-old male, having this type of lenticular opacity. What is this? Very simple. No need to put your more brain. It is a lenticular opacity. It's a senile. Sorry. It is senile cataract. And what is the treatment? Cataract surgery. That's it. Sometimes you need to be more ordinary. Don't think too much. It can be a very easy question also, right? Here, the patient is having this, developing the second side of vision. सबसे पहले तो पता करना है कि second side of vision क्या होता है. Suppose a presbyopic patient, after 50-60 years, a presbyopic patient suddenly starts seeing the newspaper without glasses. Suddenly starts seeing the paper or mobile phone without glasses. He must be very happy for some time, but this is not good. It is because of the development of the immature senile cataract. You can see this is the cataractus lens. Immature senile cataract develops. Then what happened? Refractive index of lens increases because of lenticular opacity for some time, and in that period the patient starts seeing the near object without glasses. Patient may feel happy, but it is not a good sign. This is what we call second sight of vision, and it is because of the immature senile cataract. And this type of second sight of vision is because of index myopia. This is also an important MCQ, right? Understood? All you need to do, cataract surgery. That's it. So I hope you understand the points. Now we are going to start the glaucoma related images. Okay, that is important for the coming INICET examination, right? So can you see what is this procedure is going on? Basically, this procedure that is going on is, sorry, let me clear this up for you. This procedure is tonometry. What is tonometry? Tonometry is a procedure for measurement of intraocular pressure. Understood? Now, what is this type of tonometry called? This is a Goldman applanation tonometry, right? And this is the standard So let me write the standard word. This is the standard tonometry. So the standard tonometry that is to be done is Goldman applanation tonometry. Okay, if you see this image, just remember Goldman applanation tonometry. Remember? Now, what are the other related MCQ? If they will show this image, they can ask. Other MCQ that they can ask, the principle on which this applanation tonometry is based. The principle is Imbert-Fick law, where P is equal to force by area. This is the Imbert-Fick law on which this applanation tonometry is important. So what is the area of the cornea that is applanated? तो एरिया जो होता है वो एप्लेनेटेड होता है, इट इज 3.06 मिलीमीटर. सो इतना एरिया एप्लेनेट होता है. अंडरस्टूड? नाउ a person is examining this. What is that doctor seeing in the eye with the help of this instrument? A doctor is seeing this image. A doctor is seeing this image in the eye. When the doctor is doing this procedure, this tonometry, a doctor is seeing this image, this type of image. What is this green line? This green line is nothing but these are called Myers, right? This is upper Meyer, this is lower Meyer. The doctor is trying to rotate a knot and align this upper and lower Myers. When the Myers are perfectly aligned, then the reading of the machine will give you the intraocular pressure. So the alignment is very important. So these are the Myers that has to be aligned. And let me tell you, this is the perfect alignment. Look at here. Look at this and this. So this is the perfect alignment. Okay. So I am telling you, this is a perfect alignment. They can give you the picture of different types of alignment and they will ask you to answer this. Let me give you. So if I am drawing like this, suppose if this is the cornea, so this is the Myers. So the Myers is like this, because they are so much separated. This is not good. If the Myers are like this, this is also not good. So the perfect alignment is this only. Remember this. Okay. Now, these are the different types of tonometer that is being used. This is nothing but Perkins tonometer. This is what is the specification of this? This is handheld, pediatric use के लिए कर सकते हैं, comatose, supine position में यूज कर सकते हैं this type of instrument. This is called tonopen tonometry. Okay, this is an electrical transducer that is present here and it can be used over the bandage contact lens. Over the contact lens also they can give you the reading. So the question is arising, for irregular corneal surface, what type of tonometer that we can use for the irregular corneal surface? Mackey-Mark tonometer. So the answer for this is Mackey Marg tonometer. So you need to remember this is the common type of the tonometer that is being used. Other types of tonometers are also there. Pascal is there. Dynamic control tonometer DCT, that we call DCT tonometer, is also there. Numerator tonometer is also there. That gives numerator tonometer that gives a 24 hours reading of the IOP. Similarly, we have also a 20 aqua tonometer that is fitted into the cornea that will give you 24 hours of reading. That is a very advanced thing. You need not to learn about all these things. Okay. Coming to this point, let me give you the example of this. What is this? You can see this is still, and if you see clearly, closely, this is indenting the cornea. Okay. So this tonometer is nothing but it is a it is an indentation tonometer. It is an indentation tonometer. Why it is an indentation tonometer? Because it is indenting the cornea. What is the name of this tonometer? The name of this tonometer is SCHIOT tonometer. Okay, this was the previously used tonometer. Okay, now coming to this important thing, what you are seeing that the cornea of both the eye is clouded. So this is congenital clouding of the cornea. What we are calling it? We can call it congenital clouding of cornea. Okay, it can be because of so many reasons, and depending upon the situation you can diagnose that reasons. So congenital clouding of cornea can be remembered by STUMPED, stumped. As for sclerocornea, T for birth trauma or tears in basement membrane of the cornea. This is the glaucoma, or we can say it is a ophthalmos. Okay, they are talking about tears means ये tear का मतलब क्या हुआ? They are talking about the Habs stria. So here, for this to diagnose this congenital glaucoma, you need to have a big cornea. Big cornea. How much big? More than 13 millimeter. Okay, more than 13 millimeters. It's a very important MCQ. Understood? Coming to U. U means ulceration. M for mucopolysaccharidosis. In this mucopolysaccharidosis, what is important? You need to remember Hurler syndrome can cause the clouding of the cornea. So when you have a confusion between Hunter and Hurler in any of the medical subject or MCQ, whether to mark Hunter or whether to mark Hurler, then the important thing that comes to rescue is remember cornea is affected. They in the question sometime they give the clue that there is a congenital clouding of cornea or the cornea is clouded or hazy cornea. Then the Hurlers will be the answer, right? Coming to this P for Peters anomaly. E for endothelial dystrophy. Endothelial dystrophy. For example, CHED, congenital hypertrophy of endothelial dystrophy, hypertrophic endothelial dystrophy, right? And D is dermoid, mostly limbal dermoid, right? So these are the important causes of the clouding or congenital clouding of the cornea. In this particular image, as you can see, that there is a big cornea is there. So it is a ophthalmos. Okay. And also you need to remember BPL. B for ophthalmos. So BPL, for this ophthalmos, I will tell you the BPL. BPL. Photophobia, lacrimation, and mild blooding. Or you can see big cornea. This is nothing but photophobia, and this is lacrimation. When you have this type of triad, then the answer will be ophthalmos. Rest you know the example, rest you know the causes. So remember STUMP, S for sclerocornea, T for tears, T for trauma, ulceration, mucopolysaccharidosis, Peters anomaly, endothelial dystrophy, or dermoid, limbal dermoid. Okay. Now coming to this image, what is this image actually tells you? This image you have seen one pupil, two pupil, three pupil, four pupil. So obviously, if you have more than two pupil, then it is called polychoria. And when you know what is polychoria, then the two more important things comes in the mind. One is correctopia. Correctopia is single pupil but not in center. Matlab, it is displaced from its normal central position. Second thing that comes in the mind is ectropion uvea. It is the eversion of the ectopia onto the iris. Margin eversion of the iris onto the iris upper side, right? We will discuss about the ectropion later. Ectropion uvea later, okay? What is this? When a person is suffering from the glaucoma, you will have a visual field defect. This is one of the kind of the visual field defect. And what is this type of defect is called? Let us understand what are the types of visual field defect that you are seeing in the glaucoma. So, if there is a glaucoma, if there is a glaucoma, right? The first thing that will happen is isopter contraction, and this isopter contraction is the earliest, right? Followed by bearing of blind spot. Okay. After this, that comes the Seidl's scotoma, followed by arcuate scotoma, followed by double arcuate scotoma, or it is also known as ring scotoma, followed by nasal stepping, and followed by tunnel vision. Last is tunnel vision. और ठीक है, तो the last vision to go is the temporal vision to go. So answer is one more question is last field to go is temporal. This is also very important MCQ. Understood? After this, let us draw something peculiar. Okay. Suppose this is a field. What is happening? There is some scotoma developed here. This is called Friedl's scotoma. Now, if this scotoma is coming like this is called, wait. Now, if the scotoma is becoming like this is called arcuate scotoma. If the arcuate scotoma is spread like this is called double arcuate scotoma. Okay, or ring scotoma. There is a stepping happening, and then becomes very small tunnel vision. So this is arcuate scotoma, and then what is this? Understood? Obviously, this will be a arcuate scotoma. One more important thing to understand is that the most resistant fiber is papillomacular bundle or macular fibers. So if I am telling you that most resistant fiber, retinal fibers, is papillomacular bundle. Papillomacular bundle. So this is about the glaucoma. Understood? So basically our next image, let me tell you the scenario of this image. Okay, basically what we are discussing here, the important image. Okay, this important image is consisting of, you can see there is a congested conjunctiva. Okay, now let me have a scenario. Suppose this patient is watching night movie and suddenly he develops pain in eye. Okay, and sometime associated with the vomiting. Okay, he presented to the OPD emergency, emergency, with this type of feature. So what is the diagnosis? What should be done in this case? Okay, so basically what you are seeing here the congested conjunctiva. This conjunctiva is congested, right? Second thing, what you are seeing here, this is nothing but a vertically oval mid-dilated pupil. So this is vertically oval mid-dilated pupil with some cloudiness of the cornea. This is cloudy cornea, means there is a corneal edema. So all these features like watching the night movies and having a pain in the eye associated with the vomiting, intolerable pain, complaining of there is a sign of congestion of the conjunctiva, mid-dilated vertically oval pupil, it actually points towards diagnosis. What is the diagnosis? Acute attack of angle closure glaucoma. So basically it is an acute attack of angle closure glaucoma. Now the question is started, what the treatment, what is the first thing that you are going to give? The first priority, why this is all happening? This is all happening because of increase in IOP. So there is an increase in IOP, intraocular pressure. So first priority is to decrease the IOP. So what is the main treatment here that we are going to give? The treatment that we are going to give will be IV mannitol. So okay, other thing that we can give here is tablet Dimox. Dimox tablet. What is this Dimox? It's a famous brand name. What is this containing? Acetazolamide, right? Sulfonide group of drugs. And the third treatment that you can give is to eye drop pilocarpine. What is most important here? Here you need to avoid one thing. Here you have to avoid. What you will avoid? Avoid mydriatrics. Mydriatric में एग्जाम्पल होता है आई ड्रॉप एट्रोपिन और home atropine. Now suppose you have given all this treatment to this patient, okay, then after 1 week, because it is look like inflamed, so you cannot do any surgical intervention or laser intervention here. Wait for this inflammation, this congestion to subside, because the laser will further increase the inflammation and it will complicate the thing. So give this treatment, decrease the IOP, and after 1 or 2 weeks, when the inflammation goes out, you do this. What is this? What is this? You can see here, this is nothing but peripheral iridectomy. So all those conditions where there is an acute attack of angle closure, you have to give the treatment of peripheral iridectomy. It prevents the futuristic attack of this angle closure in the same patient. Now the question arises, what is the laser that you will use here? You will use ND-YAG laser, and of course frequency or wavelength will be this one, micrometer 532. So this is very important to understand this image. Now coming to this, can you see this? So the question arises from seeing this image, that what is the procedure being done? So the procedure what is being done here, it is the procedure that is being done here is gonioscopy. What is gonioscopy? Gonioscopy is a procedure where you are going to see the structure of angle of the anterior chamber. Angle of the anterior chamber containing the 5 things. What is the angle of structure? Angle structure. Angle structure क्या होता है? Angle structure are I can see till Swalb's line. So the first thing that will be iris, root of iris basically. This is one angle structure. C is ciliary body. S is Clemens canal. Canal है. T is trabecular meshwork, and S is obviously Swalb's line. So this 5 structure, iris root, ciliary body, Clemens canal, trabecular meshwork, and Swalb's line, this forms the angle structures. So this angle structure mnemonics is I can see till Swalb's line. You understand this point? So to see all these structures, we do the gonioscopy. Now the second question that is arising here, what is the principle here? Principle here is total internal reflection. So it based upon total internal reflection help us to see the angle structure. It is based upon the critical angle of cornea and tear film interface. Okay, एक critical angle होता है. Suppose this is the cornea. अगर ये cornea है and this is the tear film. So इन दोनों के बीच में अगर ये tear film है और ये cornea है, इन दोनों के बीच में there is something called a critical angle. That is the critical angle. With that critical angle is helping us for this total internal reflection when we put this lens here. So what is that critical angle? So critical angle of cornea and tear film is what? 46 degree. Very important. This is also very important. This angle structure is also very important. Okay, understood this point. Now what is this? This procedure is called gonioscopy. Then what is this lens called? This is nothing but it's a gonio lens. ये कुछ नहीं है, ये gonio lens है. This is gonio lens. Now you have to understand the fact that what are the types of the gonio lens. Gonio lenses के types कितने होते हैं? हम चलो पढ़ते हैं. तो गोनियो लेंस जो हो सकता है, गोनियो लेंस कैन बी डायरेक्ट और इनडायरेक्ट. ठीक है, डायरेक्ट एंड इनडायरेक्ट. डायरेक्ट में यू डू नॉट नीड अ कपलिंग एजेंट, मतलब यू डू नॉट एनी विस्कस एजेंट टू पुट ऑन द कॉर्निया. सो डायरेक्ट कैन बी कॉइपीस, डायरेक्ट कैन बी बार्कन, डायरेक्ट कैन बी स्वान जैकब. ये तीन डायरेक्ट है. इनडायरेक्ट can again divided into the two parts. One is indentation, another one is a non-indentation. Indentation में एग्जाम्पल होता है जाइस 4 मिरर और पॉस्नर 4 मिरर. नॉन इंडेंटेशन में टाइप्स होते हैं गोल्डमैन 3 मिरर, 4 मिरर, 2 मिरर और 1 mirror. Different types. So this is the types classification of gonio lens. This is the angle structure. This is so basically this procedure is called gonioscopy. The principle is total internal reflection. Okay, this is based on the critical angle which is about 46 degree. What we are seeing the angle structure: iris, roots, ciliary body, Schlemm's canal, trabecular network, and Solvay's line. The mnemonic is I can see till Solvay's line. Gonio lens. This is the gonio lens that is being used here. So gonio lens can be divided into the direct and indirect part. Direct is the Coipes, Barkan, and Swan Jacob. Indirect again divided into the two parts, that is indentation and non-indentation. Indentation is Zeiss 4 mirror, Posner 4 mirror, or non-indentation Goldman 3, 2, 1, and 4 mirror lenses. Understood? I hope this makes clear for all of you. Coming to this point now. Seeing this picture, that you have to understand what is this picture indicates and what is this picture indicates. So very important to understand. No need for the interpretation of this. Only you need to know what is the investigation. So when you see this, then again this is nothing but this is a Humphrey visual field. Okay, this is Humphrey visual field. Okay, this is very important. Field defect को देखने के लिए, to detect the field defect, to detect the visual field defect, visual field defect. Okay, to understand this. Now, what is this? This picture, whenever you see, then this is nothing but this is an OCT of RNFL. इसका फुल फॉर्म लिखे तो इट इज ऑप्टिकल कोहेरेंस टोमोग्राफी ऑफ रेटिनल nerve fiber layer. So it is nothing but it is an OCT of RNFL, optical coherence tomography of the retinal nerve fiber layer. So this much you need to know only. Okay, moving to the next image. Now whenever the histology, sometimes they give the histology of the eye, of the different structure of the eye, like retina, like optic disc, like iris. Okay, So you have to understand. First, you remember this is the lamellar structure. As you can see, this is cornea. So this is nothing but this is a. You have to understand, yeah. This is nothing. This is cornea. This is cornea. On what is this? This is iris. Understood? ये तो इतना समझ में आ जाएगा. Now, if this is iris, but what about this structure? What about this reddish structure? What about this structure? ये क्या है? ये क्या है? ये structure क्या है? What is this reddish structure called? This is nothing but this is the neovascularization. ये कुछ है नहीं, बल्कि ये neovascularization of iris है. ये क्या है? neovascularization है. Vascularization of iris cell. This neovascularization of iris, also known as rubeosis iridis. And if it is rubeosis iridis, what are the conditions when you see the rubeosis iridis, that is neovascularization of iris? So the most common that the common is neovascular glaucoma. Okay, also you can see it in the CRVO, basically ischemic CRVO. So this is a very important MCQ regarding to this. Okay, understood this histology? Coming to this point, so are you understanding what is this? Let me tell you, this is an important structure known as histo of optic disc. ये optic disc का structure है. I am telling you, this is a normal. This is a normal ये histology है. Means if it is a normal optic disc histology, that means this is the lamina cribrosa. These are the plial septa, the neural fibers are there. But what about this? They will give you only this. They will tell you the histology of optic disc looks like this. What is about this? What happened to this area? This area becomes like saucer type. Saucer type, and there is a neural thinning is there. यहाँ पे neural thinning हो गया है. You can see, and there's a cupping like this. So what is happening here? This is nothing but what is this? This is glaucomatous optic disc. So basically घुमा फिरा के आंसर्स वही होते हैं, घुमा फिरा के आंसर्स वही होते हैं, बट पूछने का तरीका अलग हो जाता है. कंसेप्ट वही है, बट दे आस्क दैट क्वेश्चन इन द डिफरेंट वे. जब ज्यादा कोई चीज कॉमन हो जाती है तो क्वेश्चन पूछने का तरीका, चीजें वही रहेंगे, डायग्नोसिस वही रहेंगे, डायग्नोसिस विल बी द सेम ओनली, बट समथिंग डिफरेंट दे हैव टू आस्क and the answer will remain the same. Understood? Moving to the next question. Now here we come to the end of the glaucoma images. Now we are going to start this uvea images. Okay, so coming to this uveitic first image, what is this happening here? If you are seeing this image, then what perception you are getting? Obviously you are getting that this is a festooned pupil. ये क्या है? Wait, what is this? This is festooned pupil. Why this is festooned pupil? Because of this synechia. देखो, see the synechia here, synechia, यहाँ पे synechia, यहाँ synechia. Because of this synechia means iris is adherent to the lens. Lens के capsule से ये चिपक गया है. That is why it is festooned pupil. Where you are going to see in a case called anterior uveitis. And anterior uveitis is the inflammation of the iris structure. Iris, okay, iris structures, if they are involved, that is called anterior uveitis and anterior chamber is involved, right? Coming to this second MCQ. Okay, what you are seeing here, there the fundus photography and some geographical type of pattern you can see here. Okay, this is not in the retina, this is coming from the behind retina, from behind the retina. So when you see this type of picture, then also one thing comes into mind, this is geographical. So the your diagnosis should be like geographical, and this is serpentine, like सांप की तरह ऐसे जा रहा है ना, कहीं भी जा रहा है. This is helicoid, also we can see helicoid, and also this is not from the retina but it is behind the retina, and behind the retina is choroid. It is called choroidopathy. So basically this is this question, geographical helicoid choroidopathy. Now when you see this, suppose they will give the example of the patient is having a tuberculosis and they will have the fundus like this. So it is a serpiginoid choroiditis, and serpiginoid choroiditis have a fundus like geographical helicoid choroidopathy. If there is no history of tuberculosis, it is called serpiginoid like choroidopathy. Understood? I don't want any of you to confuse about that. Just remember what I have written. Okay, now coming to this very important questions, that if you see this picture and you have to describe this picture, then how will you describe? Let me tell you, let me help you. You will describe that this conjunctiva is congested. This conjunctiva is congested, right? You can see there is a hypopigmented patch on iris, and also there is, as you can see, the hyperpigmentation at the margin of the iris. And what you are seeing here, it is the eversion of iris onto the iris margin, right? So this is nothing but ectropion uvei. So this is the diagnosis of this condition, and this is seen in so many inflammatory conditions, right? Now this is that much for this image. Coming to this point, very important, the patient is having a 21 trisomy, that is Down syndrome, and this picture is coming. Now what you are observing in this picture, if I can tell you, you can see this hypopigmented patch. ये देखो हर जगह है, यहाँ है, यहाँ है. On the periphery of the iris, there are so many hypopigmented patch. Understood? So this hypopigmented patch, let me write here. So this is hypopigmented white patch on peripheral iris. So this is hyperpigmented patch on the peripheral iris. This is your observation. Now if the patient is Down syndrome, then this white patch is known as brush-filled spot. This white patch is known as brush-filled spot. Suppose this patient is a normal and you see this white patches. In normal patient, this white patch is called Kaufman-Wolfian spot. Understood? So the same condition, if present in Down syndrome, it is brush-filled spot, and the same condition, if present in normal patient, is called Kaufman-Wolfian spot. This is very important to understand. I hope you understand all these things. Now coming to the next MCQ. Now what you are seeing here, you can see here some nodules on the margin of the iris, and what you are seeing here, the nodule here on the middle of the iris. Now what is this nodule? What is this nodule? Both of them are present in anterior uveitis. Both of them are present in anterior uveitis. Now this is called coipes nodule. You see the K for kinara. Kinara is at the edge. It is at the edge, so kinara. That is why you remember this. Okay, and it is known as busaka. B for बीच में. Beach is middle. Okay, this is, so you remember with the help of this mnemonics the name of these nodules. Okay, now coming to this condition, now you can see that there is a fundus photo and some yellow lesions. You can see yellow lesion here, and there is a accumulation of whole yellow lesion inferiorly. So what is this yellow lesions? If the patient is having some kind of inflammation, then I can call this yellow lesion is, this yellow lesion, क्या बोलेंगे इसको? Snowballs. And the accumulation of this yellow lesion here is snow banking. Snow banking कहाँ पे है? On pars plana. So these things are seen in which condition? These things are seen in intermediate uveitis. If the pars plana of the ciliary body is involved or the vitreous is involved, everything in front of the retina, that is vitreous, pars plana of the ciliary body, if inflamed, then it is called intermediate uveitis. Understood the point? So this snowballs, snow banking on the pars plana is a feature of intermediate uveitis. Understood? Now coming to that important thing, let me tell you one thing. This important thing, when treated, it becomes like this. On treatment, it becomes like this. Now what is that? What is that? Can you see? You cannot see. It's a very foggy appearance. Okay, so whenever you take your car in the fog, only you can see the headlight of the car. So it is looking like that. So what I can call it? I can call it headlight in fog appearance. Understood? This headlight in fog appearance is seen in which condition? Is seen in which condition? Toxoplasma. And when we give the treatment, cotrimoxazole, treatment is cotrimoxazole. Then it becomes like, what is this? This is the punched. This is the punched out lesion at macula, and this is nothing but this is toxoplasma. Understood? Coming to the next image. What is this image actually is giving you the clue? Suppose I am giving you the history. This patient is HIV. Sorry. This patient is HIV positive. Understood? Now when you see, if the patient is HIV positive, if you see something is going on around these vessels. This vessels is nothing but it is a perivascular lesion, and this gives appearance like frosted branch angiitis. So this gives an appearance like frosted branch angiitis. Similarly, you see so many exudates, yellow, and there's a hemorrhage here. Okay, so many exudates here and there's a hemorrhage here. Understood? Now what is this called? This is called breast filled appearance, breast fire appearance. This is also a breast fire appearance, or we can also say it pizza pie appearance. Pizza pie. So all this like frosted branchitis, breast filled fire appearance, pizza pie appearance in an HIV patient leads to the diagnosis. So इसका diagnosis क्या है भाई? Nothing. CMV retinitis. And when it is more frequent, it is more frequent when the CD4 count is less than 50 cubic millimeter. Understood? One more important thing in an HIV patient, most common sarcoma is in HIV is Kaposi sarcoma. Understood? Now coming to this image, you can see something, some yellowish dome-shaped elevation here. Okay, and when B scan is done, ये B scan किया गया यहाँ पे. So what is, you can see some nodular or collared stud appearance is there. Let me tell you why it is not retina. You see, retina is this portion. This portion is retina. This portion is retina. But this lesion is arising from here and going like here. So obviously, it is not the retinal structure. It is something behind the retina. And what is behind the retina? Choroid. So it is something choroidal lesion. And this type of configuration is called collar stud. Collar stud appearance. Okay. And this is seen in choroidal melanoma. And one more important thing, it is about choroidal melanoma. It is the most common intraocular tumor of adult. So understood? This is the choroidal dome-shaped elevation on the choroid having a B scan. There is a collar stud appearance, which is diagnosis is choroidal melanoma, and it is the most common intraocular tumor of adult. Okay. So this ends the uveitic portion. Okay. So this ends the first part of our video lecture. Okay.